Welcome, everyone. My name is Gary Blau. I'm the Chief of the Child, Adolescent, and Family Branch here at SAMHSA, the Substance Abuse and Mental Health Services Administration. And I am tremendously excited to be able to welcome all of you to our webinar here for applicants who are interested in the community programs for outreach and intervention with youth and young adults at Clinical High Risk for Psychosis Grant Program, which we have fortunately shortened the title to Clinical High Risk for Psychosis, or CHR-P. Today, we are really wanting to just make sure we walk through this particular FOA, the Funding Opportunity Announcement, because the whole point of this is to help people provide a successful application, or to put all of your best foot forward around the creation of an application, so that not only will it be scored, but that our reviewers who and staff will discuss some of the review and review criteria here, really have a way to provide you with points in order to make this happen. So we'll be walking through the purpose, the goals of the program, and a little bit about what it is that the expectations are for when you submit an application. I do want to say that this program, while it was recently announced, has been something that SAMHSA has been working on for quite a while. If you're not familiar, that SAMHSA was first given an opportunity when we were in the 21st Century Cures Act, where we identified the need for doing something special around the clinical high-risk population. For a number of years, SAMHSA has provided a set-aside, a 10% set-aside. It was 5 and now 10% in our Community Mental Health Block Grant Program for first episode psychosis, or for first episode of a serious mental illness. But what we were not doing, and what I think the field lacked at the time, was to go upstream and to work on youngsters who've been or could be identified at clinical high risk, but were not necessarily getting services. So we looked at what mechanism was possible, and we identified the Children's Mental Health Initiative, or what we call our Systems of Care program, which has existing legislative requirements. So this particular application, as you can see on the screen, is due June 8th. We're hopeful and planning to, June 11th, I'm sorry, June 11th. And we're hoping to award up to 28 grants. So it's a fairly considerable number, at up to $400,000 per year. Because of the legislative requirements, there are a couple of things that folks will really be, focused on. Number one is that eligible applicants are government entities, government or public entities that include states or counties, federally recognized tribes or tribal organizations. And this is an issue that some folks have already asked us, which is what constitutes a public entity. And so it's a government or political subdivision. If you are questioning if your application, or if you're an applicant that meets that criteria, we've asked for a couple things. One is we're happy to try to provide some consultation, but it is incumbent upon the applicant to provide us with enough detail that you are a government entity. So we've actually had applicants in the past that have incorporated a letter from their attorneys general, for example, saying that there are legislative requirements or legislation in your state, in your locality, that identifies you as a public entity, and that there is a match requirement. And as you see, the match requirement is in many ways relatively easy for those first 3 years. For 3 federal dollars, you just provide 1 local dollar. While we love cash, that can also be in kind. And then for the 4th year, the idea is that it's more of a one-to-one approach, which helps government entities to find ways to sustain the work that is being done. So with all that being said as a context, that we were able to secure in the Omnibus Appropriations Act the identification that we could use up to 10% of our Children's Mental Health Initiative funds for this program. Right now, that's approximately a little over $12 million in order for us to do that. And that as part of that program here, we do have to follow some of those requirements, which really does about eligibility and match. And with all that being said, we should now turn it over to 2 of my wonderful staff folks, Tanvi Edgemera and Emily Litvar, who are going to walk you through the process here. If you have questions, I would encourage you to to use your chat boxes, or to hold them. We will look at responding to any questions. If we don't have enough time today, we will respond, as we go forward as well. So please don't be hesitant to ask your questions. So at this point, I'm going to turn it over to Tanvi.
Hi everyone, this is Tanvi Mera. Welcome. I'm going to now just focus on a few programmatic aspects of the application. So to begin with, we're going to go over the purpose of the CHR-P grant program. Reading it off, we're identifying youth and young adults up to age 25 who are at clinical high risk for psychosis. And this is according to the structured interview of psychosis risk syndrome. So what is clinical high risk? Clinical high risk for psychosis refers to individuals who exhibit noticeable changes in perception, thinking, and functioning, which typically precedes a first episode of psychosis. During this pre-psychosis phase, individuals exhibit one or more of the following: attenuated psychotic symptoms, brief intermittent psychotic episodes, or trait vulnerability coupled with marked functional deterioration. Moving on to the second purpose of the program, to provide evidence-based interventions to prevent the onset of psychosis. So that's kind of going back to some of the symptoms I just mentioned. And then finally, we expect that this program will improve the symptomatic and behavioral functioning. It will enable youth and young adults to resume age-appropriate social, academic, and/or vocational activities, delay or prevent the onset of psychosis, and minimize the duration of untreated psychosis for those who develop psychotic symptoms. What are some of our expectations? So SAMHSA intends that the services program will result in the delivery of services as soon as possible after the award. Recipients will be expected to implement a stepped care model, and we're going to continue to elaborate on this. But just briefly, stepped care refers to an approach in which patients will start with the least intensive evidence-based treatment, and patients who do not respond adequately to the first line of treatment are offered an evidence-based treatment of higher intensity as clinically indicated. Recipients must utilize third-party and other revenue realized from provision of services to the extent possible and use SAMHSA grant funds only for services to individuals who are not covered by public or commercial health insurance programs, for individuals for whom coverage has been formally determined to be unaffordable, or for services that are not sufficiently covered by an individual's health insurance plan. Grant recipients are also expected to facilitate the health insurance application and enrollment process for eligible uninsured clients. Recipients should also consider other systems from which a potential service recipient may be eligible for services, for example, the Veterans Administration. And this is, again, if it is appropriate or desired by the individual and meets his or her needs. We encourage the use of SAMHSA system of care principles to ensure that your application as well as the program moving forward is youth and family guided. You should consider the needs of returning vets as well as their families. And if awarded, you will be expected to develop a health disparities impact statement, which will be due no later than 60 days after award. The disparities impact statement is something that if awarded, you will get guidance from your government project officer at the time. Moving on to eligibility. This is, Gary mentioned this earlier, but we will reiterate this. Eligibility is statutory limited to the following public entities. So state governments and territories. This includes the District of Columbia, the Commonwealth of Puerto Rico, the Northern Mariana Islands, Virgin Islands, Guam, American Samoa, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands. Other governmental units within political subdivisions of a state, so counties, cities, towns, and then federally recognized tribes and or American Indian Alaskan Native tribal organizations. Now, you will also be expected to show evidence of experience as well as credentials within your organization. And these are 3 important requirements that you should definitely pay attention to as you are applying and developing this program. So the provider of direct client services must be identified in your grant application. Each mental health treatment provider organization must have at least 2 years of experience as of the due date of the application. And this experience must be in providing relevant services to youth and young adults, such as clinical assessment, psychoeducation for individuals and family members, cognitive and behavioral interventions, academic and vocational support, psychopharmacology, and medical management of side effects of medications. Official documents must establish that the organization has provided these relevant services for the last 2 years. And finally, each mental health treatment provider organization must comply with all applicable local and state licensing, accreditation, and certification requirements as of, again, the due date of this application. Key personnel. So the key personnel for this program must include individuals with experience and credentials in service delivery. There's 3 key staff that we've identified on here: the project director, the program coordinator, and the clinical coordinator. The project director will be the one overseeing the program and will be from the applicant agency. Please keep this in mind. The PD has to be from the applicant agency. They will look at oversight of your program. The project coordinator will be responsible for the day-to-day activities and operation of the program, including supervision and management of the services. The clinical coordinator will be responsible for determining eligibility and will participate in overseeing intervention and evaluation activities. These positions will require prior approval by SAMHSA after review of staff credentials and job descriptions. You can identify the amount of time that each of these staff will dedicate to the program, and this is something you want to, as you're developing your application, while we're not telling you how long or what amount of time your staff should be on for, it is something that should align with your program goals and objectives, and that's what your reviewers will look at. And I'm now going to turn it to my colleague, Emily Lickbar.
Hi everyone, my name is Emily Lickbar. I'm going to start by going over the required activities of the grant program, and you would absolutely want to address these in your project narrative, these required components. The first bullet point is to identify an organization, agency, or other qualified entity that will be providing the required services. So as Tansy stated, you will be identifying the service organization that will be implementing these services. The service agency does not necessarily need to be a public entity. The applicant needs to be the public entity, but you do need to identify the agency or clinic that will be implementing these services. Moving along, you will be implementing a stepped care model for early psychosis that features lower intensity, lower risk treatments as first-line interventions with decisions regarding treatment completion, maintenance therapy, or step up to more intensive care based on objective measures of treatment response. So in terms of the stepped care model, you would potentially be screening potential client, youth and young adults using the SIPs. Then in your application, and there will be some variability from application to application, you'll be presenting your stepped care model approach. So the stepped care model, put another way, is that youth and young adults, when they enter treatment and they have met eligibility for a clinical high risk for psychosis as deemed by the SIPs, the youth and young adults will start out with the same level of care, and you will provide information on the assessment measures that you will be measuring impairment and symptomatology, and based on the symptoms and the impairment, they will either, if there are symptoms and their impairment gets worse, it can stay the same, or it can get better. Based on those kind of 3 tracks, you will either step up their care, step down their care, or their care will kind of stay at the same level if there's no change. So again, you will be in your project narrative, you will be proposing the duration of treatment, what the treatment looks like, and what measures you will be using to determine whether you'll be stepping up, stepping down, or staying the same. In terms of the stepped model care, components of this intervention will include, again, that standardized approach to screening, diagnosis, and psychosis risk assessment, which I just referred to as impairment and symptomatology. It will also include psychoeducation for individuals and family members, substance use risk reduction, cognitive behavioral therapy or behavioral training skills, academic, vocational, peer, and family support, and evidence-based pharmacology as warranted for youth and young adults who have co-occurring conditions. You will also develop and implement training and workforce development activities for providers and staff to implement this stepped care model. So again, there will be some individual variation in the project narrative that all the different applicants are proposing, but those are kind of the main requirements pertaining to the stepped care model. Moving along, you are also required to develop and implement primary outreach strategies to engage specialty mental health services. For example, community mental health clinics, coordinated specialty care clinics, psychiatry, primary care, social service agencies, to provide education about the CHR-P program and early identification and screening procedures to assure rapid referral to your CHR-P program. Secondary outreach strategies are to be to organizations and agencies that generally serve youth and young adults, such as schools, faith-based organizations, communities, and other settings that serve youth and young adults. So put another way with this bullet point, what we mean by primary outreach strategies to engage specialty mental health services, this is for youth there's been evidence that has shown that youth and young adults at clinical high risk for psychosis, there's a greater likelihood of finding them and identifying them and making those successful referrals in like medical settings and mental health settings. So that's why we're calling them primary. Those are the primary outreach sources that we want you to target first and foremost. And then the secondary would be schools, faith-based organizations, and so on. And we would like you to target those kind of in a secondary approach, but we want you to target the primary ones first, because evidence has shown that we're more likely to find and identify the youth and young adults at clinical high risk for psychosis in those settings. So that's the difference between the primary and secondary. Next bullet point, you're required to establish bidirectional referral relationships with organizations and agencies that provide coordinated specialty care for first episode psychosis. So for example, one example of this could be SAMHSA's Community Mental Health Services Block Grant, 10% set aside for evidence-based treatments for early serious mental illness. So we want you to have these referral pathways, these bidirectional referral pathways. So should an individual in our CHR-P program step up and convert to a first episode psychosis, we already have these referral pathways intact. And then, kind of the opposite direction. If there's a youth that's at a first episode for psychosis clinic that is stepping down and they need, maybe a less intensive treatment approach, that referral pathway is stepped down to the clinical for high risk for psychosis clinic as well. So we want you to have those referral pathways, evidence of those referrals in your application as a required activity. All right, moving along. We are also requiring that you provide, coordinate, or link to the following services. So you don't necessarily need to be providing them on site, but you do need to coordinate or be able to link youth and young adults to these services. Screening, diagnostic, and evaluation services, which you will be doing. Outpatient services, 24-hour, 7 days a week emergency services. Intensive home-based services. Respite care. Therapeutic foster care. Assisting the individual in making the transition from services received as a child to services to be received as an adult, and other recovery support services such as supported employment, coordinated specialty care for first episode psychosis, as I said, family and peer support, and primary care services. You will also be required to develop mechanisms to promote and sustain youth and family participation. What we mean here is in the context of their treatment, we would like this care to be youth-driven and family-guided so that youth can really take a leadership, in decision-making surrounding their care in the context of the clinical high-risk for psychosis services that you'll be providing. Finally, you will be developing and implementing an integrated crisis response strategy that includes community-based crisis services and support to reduce the unnecessary use of inpatient services. We will now move on to allowable activities. So these are things that you're allowed to do, but you don't necessarily have to, and you don't necessarily have to address them in your project narrative. We know that it's only 10 pages that you cannot go over for your project narrative, so you really want to prioritize, what you're putting in there. In terms of allowable activities, these activities are allowable use of funds but are not required and do not have to be reflected in the project narrative. 1, Develop mechanisms to support use of flex funds to support the individualized needs of youth and young adults. 2, you're going to collaborate, you are allowed to collaborate across child and young adult serving agencies. 3, incorporate trauma-related activities into the service system, including screening for trauma treatment and taking a trauma-informed approach to care. Using evidence-based practices, another very important component of these services. SAMHSA's services grants are intended to fund services or practices that have been demonstrated with an evidence base that are appropriate for the population of focus. So under the CHR-P grant program, recipients will be implementing an applicant-selected, evidence-based stepped care treatment protocol model for early psychosis. So the meat of the evidence-based practices that you will be using, the specifics, you will be delineating in your project narrative. In section 3 of your of your project narrative, you will need to demonstrate your knowledge of evidence-based practices for youth and young adults at clinical high risk for psychosis. Applicants are encouraged to visit the NIH website right there. Data collection and performance measurement. All SAMHSA recipients are required to collect and report certain data so that SAMHSA can meet its obligations under the Government Performance and Results Modernization Act of 2010, also known as GPRA, the GPRA requirements. Recipients will be required to report on client-level data elements, including but not limited to school status, employment, hospitalization, criminal justice involvement, mental health functioning, adherence to treatment, conversion to psychiatric disorder, and mental health functioning. In addition to the client-level data, recipients are required to report on the following. These would be known as the IPP indicators for those of you that have operated SAMHSA grants in the past. These are the 3 IPP indicators. The number of individuals contacted through program outreach efforts. Second, the number of individuals referred for screening to mental health or related services. That will be the CHR-P services. And 3, the number of individuals receiving mental health or related services after the referral, so the ones, I guess, that you are enrolling. These data are reported using SAMHSA's Performance Accountability and Reporting System, also known as SPARS. Grantees will be required to participate in a national cross-site evaluation, which will examine the effectiveness of the approaches used in this CHR-P program. So you will learn more about the requirements and components of that upon award. Project performance assessment. Recipients must periodically review the performance data they report to SAMHSA via SPARS, assess their progress, and use information to improve the management of their grant project. Recipients are also required to report on their progress addressing the goals and objectives identified in the review criteria. The assessment should be designed to help you determine whether you are achieving your goals and objectives and outcomes, and whether adjustments need to be made to your project. Performance assessments should also be used to determine whether your project is having the intended impact on those behavioral health disparities that you indicated in your initial disparities impact statement. You will be required to submit an annual report on the progress you have achieved, barriers encountered, and efforts to overcome these barriers. So you would be submitting that to your project officer. No more than 10% of the total grant award for the budget period may be used for data collection, performance measurement, and performance assessment. Infrastructure development. Although services grant funds must be used primarily for direct services, SAMHSA also recognizes that infrastructure changes may be needed to implement the services or improve their effectiveness. So these are some examples of allowable infrastructure activities that you may delve into in the CHR-P program. You may develop, implement, and evaluate cultural and linguistic competence at the organizational and direct service levels of care. You may develop and implement capacity building strategies to provide sustained service delivery to youth, young adults, and their families. You may adopt or enhance your computer system, management of information system, electronic health records, etc., to document and manage client needs, care process, integration with related support services, and so on. You may collaborate with existing federal grant programs, such as we said before, the Community Mental Health Services Block Program or other SAMHSA grant programs to support evidence-based practices that address the need of youth and young adults at clinical high risk for psychosis. You may review policies and regulations to improve service delivery, including the incorporation of family-driven and youth-guided care. Grantees may use up to $25,000 in each grant year for the purchase of technical assistance services.
I'm just trying to answer some questions.
Oh, great. We will now transition back to Tanvi.
Hi, so I'm going to go back over now application and submission information. This is basically, I'm stating the basics. Your applications are due 11:59 p.m., June 11th. And yes, we're being very specific about putting this on there because I'm going to strongly recommend, and I might say this a few more times throughout this presentation, is please don't wait until the day of or 2 days before to get into the system. SAMHSA has been using NIH's ERA common system, and that's what all of you will be using to submit your application. It can take up to 6 weeks to get registered. So if you are considering applying, I would say please get that registration process started because if you're down to a week before the application and you don't get in, there really may be nothing we can do about that. So I will encourage you to get on that. At the end of the slides, we will have ERA's help desk number just in case you have questions or concerns about that. You also must register with the System for Award Management and grants.gov information. And now, what are some of the components that you want to keep track of? This is pretty cut and dry, but I'm still going to go over it. All of this is in your funding announcement. So while you have the webinar archives and you have all of this information, go back to the funding announcement for all the detailed information. Going over some of the requirements. So we have budget information. Please be sure to fill out all sections of the SF424. And then there's specifics about what you need to do in line number 4 and line number 17. And within the required application components, there's section A, B, C, D, and E, specific to budget summary, budget categories. If there is if cost sharing and match is not required for the program, you would leave section C blank. But as you know, we do have match requirements in this program. Section D is forecasted cash needs, and then section E focuses on budget estimates of federal funds. And then you will, as you go into the funding announcement, if you haven't already, you will see a sample budget right on there. The project narrative and supporting documentation. Emily mentioned this earlier, but your project narrative cannot be more than 10 pages. And the project narrative will basically focus on your program from sections A through E, and no more than 5 sentences can be included in your project narrative. Sections E together may not be longer than 10 pages. And remember, if your project narrative starts on page 5 and ends on page 15, it is 11 pages long, not 10 pages. Yes, SAMHSA is being very, very specific about this. Your supporting documentation section will provide additional information for the reviewer of your application. This supporting documentation must be attached to your application using the other attachments form from the grants.gov application package. And then you can find more instructions on this section along with additional page limitations. And that will be Appendix A 3.1, which is required application components, and Appendix G. Your budget justification and narrative. The budget justification and narrative must be submitted as a file BNF when you submit your application into grants.gov. Attachments 1 through 6. We can just quickly go over these. If your application includes any attachments not required in this document, they will be disregarded. Please pay attention to that. Do not use more than a total of 30 pages for attachments 1 to 4 combined. Do not use attachments to extend or replace any of the sections of the project narrative. The reviewers will not consider them if you do. And Please also make sure to label your attachments as attachment 1, 2, 3, etc. For attachment 1, this includes the identification of at least one experienced licensed mental health treatment provider organization, a list of all direct service provider organizations that have agreed to participate in the proposed project, including the applicant agency if it is a treatment or prevention service provider organization. Letters of commitment from these direct provider organizations, including agreement to adhere to treatment protocols and evaluation procedures, do not include any letters of support. The reviewers will not consider them if you do. Attachment 2 is your data collection and instrument interviews protocols. Attachment 3 covers your sample consent forms. Attachment 4 will be the statement of assurance, which must be signed by the authorized representative of your applicant agency. Attachment 5 is the letter to the SSA, again, if it is applicable. And attachment 6 is the non-federal match certification letter. We're going to move into the application review information.
All right, so starting with evaluation criteria. The project narrative describes what you intend to do with your project and includes the evaluation criteria in sections A through E below. Your application will be reviewed and scored according to the quality of your response to the requirements in sections A through E. So you absolutely want to pay attention to what you are being evaluated on. This is how the reviewers are scoring your narrative. You want to make sure that you're really hitting upon all of the evaluation criteria that we're about to go over. These are the sections. Section A, population of focus and statement of need, 15 points. Section B, proposed implementation approach, 30 points. Section C, evidence-based service and practice, 20 points. Section D, staff and organizational experience, 25 points. And E, data collection and performance measurement, 10 points. The pages are approximations, but it's ultimately up to you how much you're devoting to each. All right, so Section A, this is focused on you explaining your population of focus and the statement of need. You're going to identify the geographic catchment area where services will be delivered and how youth and young adults at clinical high risk for psychosis will be impacted by this project. You will describe the demographic characteristics of youth and young adults in terms of race, ethnicity, language, gender, socioeconomic status, sexual identity, and so forth. You will also describe the extent of the problem in the geographic catchment area, including service gaps, and document the extent of need, prevalence rates, incidence data, etc. For Section B, you will explain the proposed implementation approach. You will describe the goals and the measurable objectives of the proposed project and align them with the statement of need. You will identify outcomes you plan to achieve. You will state the unduplicated number of youth and young adults at clinical high risk for psychosis you propose to serve annually and over the entire project period with grant funds. How these estimates were derived and how the services numbers will be met. You'll be talking numbers, how many youth and young adults you plan to serve, very important. You will describe how you will implement the required activities as we talked about in that first section I went over. If you plan to use funds for infrastructure development, you will describe how you will implement those activities. Section C, evidence-based service and practice. You're going to discuss your knowledge with and approach to providing evidence-based practices to youth and young adults at clinical high risk for psychosis, including your experience with providing the identified services that you're proposing in this FOA. Section D, staff and organizational experience. You're going to describe the experience of your organization with similar projects and or providing services to youth and young adults at clinical high risk for psychosis and your ability to provide training and supervision to clinical and ancillary staff. You're going to identify other organizations that you will collaborate and partner with in this proposed project, including their experience providing services to this population their specific roles and responsibilities as well. Letters of commitment from each partner must be included as attachment 1 of your application. If you are not partnering with any other organizations, please indicate so. You will also provide a complete list of staff positions for the project, including key personnel that Tanvi talked about earlier and other significant personnel. So for example, a cognitive behavioral therapist, a family psychoeducation clinician, a care coordinator, a peer specialist, a psychiatrist. You will describe the role of each and their level of effort and qualifications to include their experience providing services to this population of focus and familiarity with their cultures and languages. Finally, you will identify the overall staffing and supervisory structure that will be developed and provide an explanation for how this structure will meet the needs of youth and young adults at clinical high risk for psychosis and other FOA-related requirements. Finally, Section E, 10 points. This is data collection and performance measurement. You will provide specific information about how you will collect the required data for this program, the data sources, and how such data will be used to manage, monitor, and ensure continuous quality improvement for the entire project period. Describe your capacity and willingness to adhere to the data collection and evaluation requirements in this FOA. Finally, you will be, in terms of budget justification, existing resources, and other support, you must provide a narrative justification of the items included in your proposed budget, as well as a description of existing resources and other support you expect to receive for the proposed project. Other support is defined as funds or resources, whether federal, non-federal, or institutional, in direct support of activities through fellowships, gifts, prizes, in-kind, contributions, or non-federal means. This should correspond to item 18 on your SF 424, estimated funding. Other sources of funds may be used for unallowable costs, such as meals, sporting events, and entertainment. An illustration of the budget narrative justification is included in Appendix L.
All right, so we're now going to go over application tips. So a couple of, again, a lot of these are obvious ones, but I just want to keep reiterating them. So firstly, please make sure you meet the technical requirements or the application will be screened out and not scored. Specifically, that you are a government entity. Second, review eligibility information in application and submission information sections very, very carefully. And please review the evaluation scoring criteria, as that is what the reviewers are going to use to score your application. So everything that Emily just went over, you really need to focus on that, and that's what the reviewers are seeing, and that's basically what they're basing their score on. Again, double check your requirements, that any of your application requirements, to make sure you're not going to be screened out. If you have questions, I know many of you have already reached out to Emily and myself. Don't hesitate to keep reaching out to us, especially if it's something involving if you're not sure if you're eligible or not. Make sure you have all your required forms, and then that your margin and your font and line spacing requirements, and you're meeting your page limits. Just focus on that. That 10-page limit is, they're being really particular about that. Now, what is beyond writing your narrative? You can focus on those 10 pages, but then there's other things that you want to make sure that you're setting some time aside for. So obtaining letters of commitment and MOUs, gathering the CVs and collecting different job descriptions for some of your key staff positions as well as the other staff positions, editing to get the character count as well as your page limit on track, scanning all of your documents into PDFs for the submission, completing federal forms, finalizing an approved budget, getting the application through your applicant agency to sign off. So I know sometimes we're going into, your agency may have higher levels and you may need a lot of signatures going up different levels. So just make sure you're getting all of that done. And then registering for SAMHSA's new system. Again, this is NIH's ERA common system. And you want to make sure that you are registered. It does say here allow up to 6 weeks for registration. Now, if you are funded, a notice of award will be emailed directly to whoever you have designated as your business official. in your application. We do not do any paper copies anymore. So be sure if there's someone else who is managing the project, but your business official is another person, just be sure to follow up with them because they're the ones who will get an email. We don't have an exact date for the release of the results, but we're hoping it'll be sometime mid-September, and we anticipate the grant to start about September 30th. So we have this for questions, but I think we've been responding to quite a few questions. We have time. We have about 15 minutes for more questions. So if you want to keep them coming in the chat box.
Or they can just
or if we want to unmute the lines, we can do that as well. I've moved to the next slide where you have all of our contact information. So there's Emily and myself for program questions, and there's Gwen Simpson for any of your budget-related questions and things like match. And then you have the ERA help desk, just in case you have any questions for them and getting into the system.
So Candy Molina asked about whether single-spaced is okay, and I was reviewing the application here under Section 5 where it says that about this, and it looks, yes, I like the answer that single-spaced is fine. You have to make sure to follow whatever it is that the funding announcements, for us, they change a little bit year to year. So I just always want to be really cautious about how we respond to this. So go through it, but if it doesn't say, I do believe somewhere in the FOA there is margins you have to follow. So just make sure that you're following those things. But it looks to me that there's nothing that precludes.
She got it.
Oh, she got it. Okay, good. Found it. Page 40. Thank you.
These kind of like modern.
So we do have additional questions coming in the chat box. I would suggest that we try to avoid unmuting all the lines to avoid feedback.
Yeah, Denise, would you mind moderating for us, and
Absolutely.
So we can do the questions in a controlled way as they're coming in?
Sure. Next question is from Ann Sutherland. How are you identifying an agency if you're required to RFP for services?
That's a tough one. That historically, it really depends on your government requirement. Historically, because this is a competitive process, most government entities allow for you to choose that because the federal process is already competitive. So you can choose, and then it's competitive whether you get it or not. If you have to RFP it even before applying, then that will make it really complicated, and because it is a requirement of the grant program that you identify the agency that you're going to have as the clinical high-risk services group. I wish it was easier than that, but again, historically we have been informed that most places get around that particular requirement by using the federal process as the RFP process. So if you're required to RFP, this is the RFP.
Thank you, Gary. The next question is from Ming. Are all three categories in SIP?
Yeah, I don't think so. I think that it's really just about attenuated symptoms and that it helps you to determine the eligibility. The other categories around whether kids are getting better or worse or whatnot, that's something that we're looking for our applicants to try to identify. We're looking, and we're going to compare, or hopefully be able to do some comparisons about what people are doing.
Great, thanks. It looks like Ming was typing again in the chat box. We'll get back to that in a second. Next question is from Jason. Thank you for the great overview. And a question about the announcement is pretty specific about the three key roles. Can you give us more context as to what you envision broadly for those three roles?
You want to jump in?
Yeah, go ahead.
So in terms of the PD role, that would be the role with the applicant agency that really is the liaison between the program and the federal government, the one who addresses fiduciary information and finances, the person who is essentially, has the broad oversight of the program. So that would be the PD from the applicant agency.
The project coordinator is like someone who is going to be looking at your day-to-day activities, managing the day-to-day activities, making sure that the referrals are accurately coming in, the screenings are on track, coordinating with the clinical coordinator to make sure that evaluation is on track. Services are beginning as soon as possible when the grant has been awarded, along with reassessments, along with making sure that the tools are in place. So that's kind of the everyday stuff.
Doing the continuation application, writing up the progress reports, interfacing with the GPO.
Yeah, that would be like the regular contact. And then the clinical coordinator is, I would say, kind of on the ground, getting the work done with the specific service aspects and the follow-up with the evaluation pieces for the treatment.
Great, thank you. Before we go on to Patrice's question, I just want to follow up. Vicki has a follow-up question. Can the grantee contract out for their PD?
So the grantee cannot contract out for the PD position. They can for the project coordinator and the clinical coordinator. The PD in the FOA has to be from the applicant agency.
And just to jump in, because Vicki is already a grantee, and this is a little bit different terminology than we've used in the past, because historically we've asked that the principal investigator or the PI be from the applicant agency, and you can contract out the PD. In this case, just for your thinking, the PD is more like the PI, and we don't want to use principal investigator because SAMHSA's nomenclature, the language is changing because we're not an actual research entity, so it's not an investigator. So the answer, as Tanvi just said, is that no, you don't contract out. It belongs to the applicant agency.
Great. And Vicki says, thank you for that clarification. Let's go back to Patrice. What entities would you recommend for technical assistance and training to support CHR?
So there are a number of folks out there that are doing that. We really can't recommend any specific ones. I would certainly recommend that you reach out to folks and get that information. There are some groups out there that are doing this kind of work and that have done training in technical assistance, but unfortunately it would be too challenging for us to recommend something like that because it wouldn't be create equitable playing fields for folks. Sorry.
Okay. So Ming has two questions. One, let's go first with the clarification about the positions. Are PC and CC staff costs considered infrastructure or service budget?
Service budget. Yeah, I think you make a case for them to be service budget, especially the clinical coordinator position who's doing that oversight of the clinical pieces, and because it's on site, I would put them in the service budget. That would be me. Great.
Thank you. And then Ming was also she wanted confirmation about generic risk and Brig intermittent are not considered high risk. I think that's
sorry, Denise, I'm just going to quickly reconfirm one more thing from Ming's earlier question. For the PC and the CC, Ming, that can also be in your grant administration cost. So it may not be an infrastructure service budget, but it could be your admin cost.
And again, I mean, if folks have the opportunity to sort of, see how those budgets work out and then provide, a justification for us, I think the real issue is that as long as you justify it appropriately, then that's okay.
Great, thank you. And then back to Ming's clarification or confirmation about genetic risk.
Ming, pertaining to your other question about the SIPs, we're gonna put together something in writing.
And maybe if we could get something specifically about that, what you're really asking for, we could respond in writing. I don't want to say something that we may not be understanding right now. So if you want to confirm something, feel free to email us, and we can create. And what we would do, just so everyone knows, is that if we get several of these or questions that folks are, we'll put them on the web as frequently asked questions that you can go back to. So everybody has the opportunity to take a look at that.
Yeah.
And yes, there are categories. There are categories in the SIPs. So if they're part of that, then it's all part of the eligibility of clinical high risk.
And Tamara has indicated in the chat box categories and SIPs. Thank you, Tamara.
Thank you, Tamara.
Looks like here's Candy. Do you have specific recommendations for assessment tools for symptoms and impairment, parentheses, for step-up, step-down determinations?
So again, you know that we are looking for our applicants to demonstrate their, their thoughtfulness in this area around assessment tools. There are many of them. I mean, you know, that there's a whole variety of tools that assess symptoms, that look at impairment, functional status, for example. And so at this time, what we've asked, or what is in the FOA, is that that's the expectation, and we have not provided a specific tool for folks to use. We will look to the applicants to share their strategy.
Okay. Any other questions? Looks like we have a couple others typing in the chat box now. Tamara and John. Yep. Apparently it's kudos to you. On the screen now, additional program questions can be sent to both Emily and Tanvi, and their emails are there. Questions about grants management and budget and ERA, go to Gwendolyn Simpson. And it looks like that's a wrap, guys.
All right, well, we want to thank all of you for your interest and willingness to sit through this. This will be captioned and put on the SAMHSA website, samhsa.gov, so people can go back to it, or folks that were unable to join us will also have the same opportunity to hear the same information. If there are additional questions, again, we will package that, and so check back to the samhsa.gov/grants under our FY18 funding announcements, and if we do, there'll be a little toolbar or something under our announcement that says, click here for frequently asked questions, and you can follow up with those. So lots of good luck to people, and we wish you the best as you develop your applications for our clinical high risk for psychosis program.
Yay, good luck.
Thank you.